In the recent edition of the MedPage Today ASCO post, I reviewed this article on the important topic of pancreatic cancer, which is one of the most widely feared cancers in existence. When we think of beating cancer, we're often obsessed with new technology, the latest targeted therapies and diagnostics, health system access, and of course, physician skill and expertise. However, what's often overlooked is the importance of solid caregiver support during the vulnerable periods of illness. Conducted at 3 large academic institutions, this study evaluated the impact of unpaid caregivers and family on the outcomes of pancreatic cancer. In addition to categorizing the demographics of these patients plus caregivers and reviewing their daily duties, the authors were particularly interested in identifying any potential stressors. And not surprisingly, there were significant stressors identified, including intensity of the care required, symptom recognition, financial burden, and psychosocial stress. In fact, when the authors looked at depression, PHQ-9, and anxiety, GAD-3 instruments, nearly 17 and 25% respectively of the caregivers tested positive. This study certainly had some limitations and could be expanded to other populations and even other cancers. I would love to see how targeted interventions for these caregiver challenges could improve cancer outcomes, including length of hospital stays and recovery time, cost of care, and survival plus response rates. I would also love to see how we can improve the mental health or even financial toxicity experienced by these patients and their families. In any case, these results point to the often overlooked factors that we need to do a better job of recognizing to impact cancer care. And these include setting realistic expectations, providing better education, including financial resources, enrolling into caregiver support groups, leveraging home health, and addressing the mental health of not only the patients, but also their caregivers who are struggling with the disease and supporting them alongside them on the journey. Read the full MedPage article down below.